The surge in COVID-19 cases is pushing some hospitals to their limits and causing thousands of surgeries and other procedures to be canceled or rescheduled in Saskatchewan. More patients are being transferred to other facilities. That's prompted Stars Air Ambulance to add a third helicopter to its fleet. Dr. Dallas Pearson is a Stars flight physician and an assistant professor of emergency medicine at the University of Saskatchewan. Hello, doctor.
Hi, Fiona.
So what's the level of risk of moving a patient from one facility to another?
Oh, it's tough. These patients, we've done a fair number of them within the province. We move from regional centers like Prince Albert, Lloydminster, Yorkton, Swift Current, into Saskatoon and Regina, our tertiary care centers. We've moved between Saskatoon and Regina to create room and alleviate pressures. We've even moved a few out of Saskatoon and Regina into regional centers. So we're moving kind of everywhere we can, as safe as we can, to alleviate the pressures. Now, as you can imagine, these patients are sick. They're on ventilators, breathing machines, they're on medications helping to maintain their blood pressure and their heart rates. It does create some transport things we have to think about, and we work very closely with the intensivists, the transport physicians, the intensivists at both the receiving and sending facilities, as well as our highly skilled crews, our nurse and paramedic teams, before the transport, to ensure that we've got the patient as stable as possible. So we're planning ahead, and then we take all the steps during transport to transport them safely. But these are not probably, I was going to say probably, but not probably, these are the most complex patients we've continuously transported, for sure.
What help do you still need?
Man, it's a great question. We need the numbers to start going down. We need the vaccination rates to go up, because we know that causes the number of infections and thus the number of critical care patients from COVID to go down. Because we're dealing with all of our regular critical care patients. That hasn't changed. The really bad car accident who has a severe brain injury, the severe heart attack, stroke, these patients all still exist and all still need our support and the intensive care support. Now we have this huge volume of COVID positive patients requiring critical care, and we need that volume to go down.
Well, thank you for this. Dr. Dallas Pearson is a Stars flight physician and an assistant professor of emergency medicine at the University of Saskatchewan.